What's up, guys? Welcome back to Cherokee Hacks Life. So let me kind of give you guys an update post labrum surgery. So I'm about now officially 5 weeks out from surgery, and last week Wednesday I went and actually saw my doctor, and he didn't give me the results that I actually wanted. I thought I was making really good progress, but he wants to see more. And again, I'm 5 weeks out. He wants to see a lot more progress. It's just his aggressive way of doing it, I think. But it really is helping just doing what he wound up telling me to do. So he wound up saying that I need to go to physical therapy. Kind of sucks, but my loss is really your gain. Because now what I'm going to do is every single physical therapy program that I'm doing, I'm just going to turn around and show it to you guys. So that way you guys at home can save yourself the money on going to physical therapy. And I'll just kind of just do it, and you guys just follow along if you have the actual same problems that I have and you had a torn labrum. And I asked my physical therapist. She said this is very similar. Some of the workouts are very similar to what you do for a rotator cuff. Rotator cuff is just a little bit different because you have to get that external rotation as well, but these are basically the workouts. So there's 8 different workouts that I'm going to be showing you guys that you'll probably be doing in physical therapy. And one of my subscribers actually mentioned that he wanted to get, he already has the lateral movement, or he already has the upward movement, but wants to get the lateral movement as well. And that one's tough. Now, your doctor might prescribe something different for you. Some doctors actually prescribe that you do 6 weeks in the sling at night, and then during the day you kind of move it around just a little bit. My doctor straight up, if you guys remember from the previous videos, he just said, hey, next day, take the sling off. And my understanding from when I spoke to him and to my physical therapist is that some doctors do different procedures. I think there's like 2 or 3 different ways to actually put the anchors into the labrum. My doctor does, he does the surgeries for all the Magic players. So the Orlando Magic players, he's actually their physical therapist. He is, not their physical therapist, their orthopedic surgeon. He's the doctor for the actual Orlando Magic. So he does sports related injuries all the time. So he tries to get you out back as quickly as possible, obviously. So his technique is, from my understanding, top notch. First, let me preface this with each one of these workouts that you're doing, you're holding for 10 seconds on some of them, and I'll explain which ones you're holding 10 seconds on, and you're holding on 3 seconds for the other ones. You want to do at least 10 rounds of each one of these exercises before moving on to the next movement. Very straightforward. You guys will kind of see what I'm talking about here. You want to grab yourself a towel, just a regular plain towel, something small, like a rag or something would be fine, because it's slippery on like a wood surface or on a table, so it'll slide. You want to grab yourself a bat or a stick. Broomstick is fine. I have a bunch of bats laying around, so I just grabbed the bat. Worked out fine. And you want to grab yourself something that weighs about 2 pounds. So for me, for example, you see what I grabbed. I grabbed the fire extinguisher. Weighs about 2 pounds. It's really tiny. Oh, and you want to grab yourself a jump rope or a wire, something long enough. I would say probably about 4 feet or so. Now, let me kind of show you guys these 8 workouts and just follow along with me. The video is a little shaky. I had my son do it. He did a great job, so give him a quick little round of applause. Give him a thumbs up just for that. And he actually recorded me. My daughter did as well on some of these videos. So check these out. Hopefully you guys are learning along. And again, it kind of sucks going to physical therapy, but again, my loss, your gain. You guys get to experience this stuff and get to work out along with me, I guess. So this first one, you're going to sit down right next to it, perpendicular to the table. You're going to slide your arm all the way up, hold it for 10 seconds, slide it all the way back down. Next, you're going to, same exact position after you do 10 of those, you're going to slide out at a 45-degree angle, hold it for 10 seconds, and then you're going to slide all the way back up to the top. This one, you're going to move up a little bit more, so that way you're right parallel with the table, and you're going to slide out, hold for 10 seconds at a 90-degree angle, come back, boom. That's 3 right there. This one's hard. This one you're only holding for 3 seconds. So this is a thumbs up. You need to come straight up. This is going to give you that lateral movement. Boom, straight up. and then you're good. Then the next one, you're gonna come straight forward, up over your head as far as you can to try to get it as straight as possible. Hold it for 3 seconds, and then come down. Slowly. Every one of these movements are slowly. This one's a little hard. If you notice, it's an overhand, underhand grip. So you see, my right hand is overhanded. My left hand is underhanded. And you want to put it at a bit of an angle. If you notice, my arm is at a bit of an angle, and you want to push out. Here's what it should look like. It should look just like that on the other side. So let me give you another angle on this one. See, I'm holding it at about a 45-degree angle, underhanded, overhanded, and you want to use your right hand to push your left hand as far as it'll go. Feel the squeeze, feel the tightness. It will hurt a little bit, just don't kill yourself. Same thing here, you want to do the same workout, but you're going to go at a 90-degree angle, just straight flat, instead of the other way. And then here, we're using the fire extinguisher, or just something that weighs 2 pounds. You're basically doing a dumbbell press in front of you. So it's just going to pick up, boom, go up, hold for 3 seconds, and this is going to feel ridiculous because it's only 2 pounds, but it works. This one is going to be a stretch. This one you're going to stretch straight up. You're basically using the rope on a hinge of your door, or whatever you want to use really, and you want to stretch your arm up as best as you can. So you're going to let your left hand kind of pull back down, or whatever arm is injured, and you use your other arm to pull the other one up to give it that good stretch all the way up. Just hold for 10 seconds each single time. Do this slowly. Don't overexert yourself. Don't go nuts trying to do these too quickly. The point of this is to try to get as much range of motion as possible at this point. You're probably 5 weeks out. You're frustrated with the situation already. You want to get back to a normal life. Trust me, I feel you on that one. These exercises will help. I've seen a big improvement in what I've already done. There's certain stretches that a physical therapist will do with you that I'll try to show you guys as well on another video, but it's complex in that you have to have someone else do it with you. So these are the kind of exercises that you can do alone. So all of these are almost the exact same thing that a physical therapist would be doing with you, except for the actual stretching. In that instance, they're holding you and giving you a nice stretch on your arm. So you kind of feel that stretching. But that one's a little bit tougher, and I'll try to do another video on that one and kind of give you guys updates. But hopefully you guys like it. Hopefully this helps you out a lot. Hopefully it saves you guys some money on the physical therapy side. Literally, these are the exact workouts that they're going to be giving you. You know, if you guys like it, like, subscribe, comment down below. Let me know what you think. Catch you guys on the next video. Talk to you later.